This podcast is about the Berbers, also known as the Amazigh, an indigenous group in Morocco, and the health issue of infant mortality within this group. Throughout this podcast, we will be incorporating critical social theory, focusing on emic and etic perspectives that contribute to infant mortality. Morocco is located in the northwestern part of Africa. It has a population of roughly 35.7 million, with the Amazigh accounting for 40%. Morocco gained their independence in 1956 and agreed to become a constitutional monarchy under control of the Arabs with a democratic government. Despite this, the king has authority over many aspects of the government, and the Amazigh have no civil or political rights. In 2017, the under 5 mortality rate in Morocco was 23 in 1,000 live births, 4.6 times the Canadian rate. This rate has improved in the last couple of years, however much of this comes from urban areas, while the majority of the Amazigh population live in rural areas. This rate remains a concern as this is a baseline indicator of how a country is ensuring children's rights to life, healthcare, nutrition, water, and protection. The Amazigh live in scattered communities situating mainly around rural mountainous regions in Morocco. They mostly reside in deserts and places with limited or no access to healthcare or other infrastructures. Morocco's economy relies heavily on the export of raw materials, and as of 2017, the country's GDP was 109.709 billion. Data from 2015 indicates that 5.528% of their GDP was spent on health that year. Morocco also has a number of political parties. However, the king holds absolute political authority. He approves all government appointments and chooses the prime minister from the largest political party. The king's overpowering political presence has left citizens feeling powerless and unrecognized, with women and the Amazigh people being the most affected by this lack of power. There are very few women in any areas of Moroccan government, and in turn this has been reflected in the areas of women's health and infant mortality rates. The Amazigh identity has been largely unacknowledged in Moroccan politics. Until 2011, there had been no constitutional recognition of the Amazigh people in Morocco. In 2011, Tamzight has been recognized as an official language. However, this remains to be the only political recognition of the Amazigh people in Morocco, and they still face political systemic discrimination policy. The etic perspective. It was found that diarrhea, respiratory infections, malaria, and measles were among the major causes of infant mortality among nomads. High rates of infant morbidity and mortality in the first 5 years of life reflect poor nutritional status and healthcare. Morocco's health system is organized into two sectors, with the public sector providing free healthcare services while the private health sectors provide healthcare to the employees of the private and public sectors. Inequality exists in Morocco's health system and lacks adequate regulation, which favors the richer population. These inequalities include poor access to rural health centers, distribution of qualified midwives between urban and rural locations, non-satisfactory management of public hospitals, better policies for healthcare professionals, the lack of community participation, and the lack of partnership policy with the private sector in regards to sharing professional and ethical training. One of the factors contributing to infant mortality in nomadic cultures is nutrition. Many Berber nomads rely on milk and grains for nutrition. Goat herding is used as a major source of food. However, severe climate change, such as drought, can threaten the livelihood of nomadic Berbers and make it difficult to obtain proper nutrition. Another factor is sexually transmitted diseases. Syphilis is an epidemic among some nomadic groups which can cause prematurity and low birth rate. Different opinions were stated as ways to optimize healthcare for the Amazigh people. The one with the most interest was the possibility of primary healthcare services for nomadic population. But primary healthcare is only possible with community participation. Community participation is practical to enforcing change and is consistent with the criteria of critical social theory. The challenge in involving the community and enforcing change was the degree of distrust and fear in the government. An important condition for the success of healthcare to nomads is that it should avoid all appearances of being a vehicle for government interference. The emic perspective. For the past few centuries, the Berbers have been portrayed and perceived by outsiders as sand-dwelling savages, the name literally meaning barbarians. But they name themselves the Amazigh, the free folk, practicing and protecting a rich, vibrant, and unique culture from the encroaching pressures of the Arab world. Amazigh women still face hardship throughout the course of motherhood. Poverty, illiteracy, and lack of infrastructure make it difficult for the expecting mother to access healthcare. Children are most impacted by poverty. Illiteracy rates for Berber women remain as high as 90%. Early marriage and early birth is encouraged among Berbers. Giving birth as early as 16 puts mothers and their babies at a risk for higher mortality. The birthing process is supervised by untrained midwives coupled with unsanitary environments. Also, lack of clean running water or electricity led to precarious circumstances for the already vulnerable babies. Education is the key to empowering the Amazigh women. The engagement of the Moroccan government to achieve the Millennial Development Goals influenced the construction of national strategies against infant mortality. For instance, the Ministry of Health has been conducting awareness campaigns for new and expecting mothers about the importance of breastfeeding in the first 6 months as one of the strategies to eradicate infant mortality. There are numerous vaccination campaigns throughout the year for the newly born, but turnout remains poor. Some programs of primary health care to improve infant mortality rates are now free of charge and universally available in urban and rural areas.